Welcome to our ice cold talk with Dr. Daniela Greiner-Krüger. We are at her clinic today and we're going to talk about a non-surgical alternative to get rid of stubborn fat cells which are resistant to any kind of sports or diet. CoolSculpting is a product of Allergen Aesthetics and it's very effective when it comes to these fat cells. Thank you, Dr. Greiner, for having us here in your clinic.
It's a pleasure. Thank you.
How long are you working in this field? You are here in your clinic, so how long have you been working for aesthetics and medicine in this field?
Well, I'm a board-certified dermatologist, and I started my own practice here in Oberursel in the northern part of Frankfurt in 2001. Prior to that, I was at a university setting at the Frankfurt University, and I also had a scholarship for 2 years at the Duke University in North Carolina. But after that, I really went into private practice and opened my clinic here. And now I'm in the midst of all this fancy stuff and first of all, the CoolSculpting. So I'm really interested and my biggest interest is the aesthetic dermatology. And the body contouring is really one part of it. And I started to be interested in the body contouring area for about 10 years. So I looked at all the different techniques with like laser, with radio frequency, and like the cryolipolysis. And I think it's really a great technology, what we have in our hands.
CoolSculpting is the original cryolipolysis procedure. How was it invented?
Well, that's a really interesting story. It really dates back to the last century, to 1970 and the 1980s, when it was recognized that the babies which were chewing on ice, they developed some kind of atrophy or loss of fat tissue in the cheeks. So that was the first observation. And then we also had these ladies in Canada which were horse riding outside, and you know it's pretty cold in Canada. So when they came back, it was like the outer part of the thigh was frozen. And they really recognized dimples, and they also like loss of fat in that area. So this was like an observation. So this led to the idea, what is icing doing with fat cells? What is cooling doing with fat cells? And this led to the invention of CoolSculpting.
So that is how it started, right?
Yes, that's really how it started.
Very interesting. Do you have a number for us? How many treatments have been processed or done worldwide, so more or less?
I think it's about 8 million treatments have been done so far. So it's really the procedure with the highest number of applications.
So this seems to be a very great alternative for a non-surgical procedure when it comes to stubborn fat, because I think there's a lot of men and women who have some fat cells here and there which they cannot get rid of, neither with sports or with a special diet or something. Is anybody suitable for CoolSculpting, or is there some people who cannot use it or others can use it better?
I think it's, it's ideal for patients who have a body mass index which is below 30. This is considering the area that we are treating the double chin, then we can go up even to a body mass index of 46, but otherwise the other reacts just better. It's really ideal for patients who seek body contouring. It's not for fat loss. So if someone really wants to get rid of fat, it's better to do that with a liposuction. So the best patient for CoolSculpting is someone who's really on a regular diet and who's doing sport and who's just really annoyed by some of these stubborn fat pads which just don't want to go away. And they can be on the flanks or in the abdomen or the double chin. And those are like really perfect indications for CoolSculpting.
So that's the way where we come to the next point. Maybe which parts or which areas of the body can be treated with CoolSculpting?
There are so many. You can't believe it. Let's start from the head. If you look at the head, then so we have the double chin area. And but it goes also down, and some women are really annoyed. They have these little rolls here in front, just next to the top. And also on your back. If you look at the back, some have rolls more in the upper back, or in the lower back, or on the flanks, or even just above the hips. And you can really individually target these little areas. On the frontal part, you can also treat the male chest, the male breast. Yeah?
Okay.
If you have problems there, you can treat the upper part of the abdomen, you can treat the lower part of the abdomen, and then comes the thighs. Yeah, there are so many areas on the thighs. You can treat the outer parts of the thighs and which is very popular at the moment, the inner parts of the thighs. You can treat the upper part or the lower part, which is going in the direction of the knee. Yeah, and then if you turn backwards again, we also can treat the banana roll, which is like a fat roll right
below the buttocks, right?
Yeah, that's a good one.
Well, yeah, sometimes we women we know the really bad parts, so also like upper arms, I guess. So, is there any part of the body that cannot be cool sculpted by that way, or treated with cool sculpting?
At the moment, we don't have enough experience with treating the knees or the lower legs, so we are a little bit careful with that. Yeah, that's not recommended.
But otherwise, there's almost no part in the body that cannot be treated.
That's right.
So, for, especially if we think about that, it's non-surgical, so without the high risk of a surgical procedure. How often does cool sculpting need to be applied? Is it one way, or is it how often do you have to do it with a patient, or is it very different from patient to patient?
So, how many cycles do you have to do? This is depending on your treatment goal. Yeah, if you have someone who has got only minor fat pads, it's definitely less than someone who's got more. It's also depending on the areas you have to treat. So you have to pack up an individual package. Yeah, it's hard to put it just with 1 or 2 treatments. Yeah, you have to see how the patient is reacting. Yeah, so usually after 4 to 6 weeks, you see the first results, and the final results you can expect after 3 months. Yeah. So some of the more experienced doctors, they already see the patient and say, oh, it's better for you to repeat the treatment after 6 weeks. So they schedule the treatment. So it's really individual. So
you can also repeat the cycle between the results or the final results. You can
do that. Yeah.
And of course, I mean, everybody is maybe like very eager about how to know how long is a treatment? How long does it take? Do I have to prepare for it, or take a couple of days free, or how does it work?
Yeah, that's wonderful information, because it's nearly like a lunchtime procedure.
Okay.
So some of the applicators, they suck in the skin, and they need about 35 minutes per cycle.
Okay.
And that's just one applicator which you have to put on the skin. That's the applicator for the outer thighs, and this one needs 75 minutes.
Okay.
Yeah. But don't forget, sometimes we have to treat several areas. What's very important with CoolSculpting is that you have to cover the whole area which is of concern. So if someone comes with the flanks, some they have very small flanks, others have a little bit bigger, bigger flanks. So sometimes I need 2 applicators per side. Yeah. Sometimes 1 is enough. In my clinic, we've got 2 CoolSculpting machines, so we can do the so-called dual sculpting. So we can use 2 applicators, 1 on each side. So this cuts down the time the patient has to stay in the clinic. So imagine that if you use 2 applicators in 2 hours, you can do nearly 6 areas. Yeah, well, that's quite a lot.
Very promising. Yeah. So some people go for tomato soup during lunch, others go for getting their stubborn fat cells being iced, put on ice. If you have any questions, we cordially invite you to ask them via chat, so because we can answer them later. Dr. Greiner, that sounds very, very promising, especially for people who have been like annoyed by their stubborn fat cells that they cannot get rid of, and maybe being afraid with a lot of reason before liposuction or like an operation procedure. Is the treatment with CoolSculpting, is it painful? Does it somehow hurt?
Yeah, pain is very individual. Yeah, it's tingling a little bit at the beginning, because we have a body temperature of about 36 degrees. Yeah, and now it's cooled down to plus 4 degrees. Yeah, at the beginning you can
putting
feel
your
that.
hand in the freezer, right? Like
in the freezer, yeah. So it's like that. So it's cooling down, and you feel that it's like a tingling. It's a special sensation, and then it stays at that temperature for the rest of the treatment, for the rest of the 35 minutes. And after that, there's this really this short time where it's a little bit painful, because after that it's like the skin is is frozen and you have to massage it. And that's just I usually compare it like in winter time when you have been freezing outside and you come into a warm room, then you get this tingling sensation.
You wash your very cold fingers and
it starts to burn. But that's really only for about 2 minutes. For that time. But this massage is very important because it showed if you massage that for about 2 minutes, it gives you 68 better improvement.
Oh, so it's very important to massage it afterwards. Okay, that's very interesting. Are there any restrictions after the treatments? Do we have to take care of? For example, if you compare it with the classical liposuction, there's a couple of days that you have to take care of or doing no sports or so.
No, you really can't compare it with that. It's much easier. I advise my patients to drink water, about 2 liters per day, and I really advise them to do sport. Because it's a good way to address that individual fat pad. Because now we sort of showed the body where he has to do something.
So
and if you go to the gym, and do your sport routine, especially addressing that area, you have great results.
But not at the same day, maybe, but next day you can go back to sports and through your routine. Are there any risks? Because I think a lot of people are very afraid of risk or side effects when they do the CoolSculpting.
Well, we had 8 million treatments so far. What's reported is like this tingling sensation. Sometimes we have got bruising. It could be swollen for a little bit. And some people experience like a paresthesia. So they have a kind of strange feeling in that area.
Numb or something?
Like numbness. That's a good description. It's like numbness, and it's for about 4 to 6 weeks, and usually it's gone after that time.
But it's not something that you can, I mean,
no,
you can live with that.
It's actually it's something that you have on a routine base. I think it's because you've cooled down the area, and that's why the nerves are a little bit irritated, and then that's why you have the numbness.
How effective is the treatment? Are there some people who correspond to it or respond to it like earlier, or other people take a little longer?
It's always hard to say at the beginning. So we've got patients. Some of my patients, they are really happy after the first cycle. Some they need several cycles. Some they it's also a question what you want to achieve and what's your goal is, what's your personal goal is. So you have to adapt to that.
So I think we have to come to the point, because a lot of people, of course, ask themselves, liposuction is quite expensive if you go for that. How expensive is the treatment with the CoolSculpting, or a session, or 1 or 2 cycles?
I mean, looking at Germany, it depends on the area where you live and what prices the doctor charges. I think the CoolSculpting cycles, they start with about 400, 500, 600 euros, and usually the doctor creates a package for you, because I think it's always important. It's not just one cycle. You have to see the individual area which is of concern to the patient, and as a doctor you have to advise the patient if you need 1, 2, 3, 4 cycles, and then you can find an adequate price.
Let's talk about the treatment process itself. When I come to you as a patient, how does it work? What kind of questions can I expect you asking me?
Well, when you come to us as a patient, we first have a look at your body mass index, and then we look at the area which is of concern to you. We discuss with you the different treatment options. Then we also would take photos, because it's very important to take a before and after to evaluate the treatment.
There's only one chance for that, right? The before, exactly. Right. So, and then is there something how you can support your patients when they come with a maybe indifferent opinion about, I would like to get a little slimmer, or look this and this? Can you support them? Is there any special questions that you're asking them?
We are actually, we prepared some cards like that. So we have several cards, like if someone now, especially in the Corona time, if someone wants to look defined in his suit, like some of the men do, we offer them special treatments in the flanks and in the abdomen. Some ladies, they've got problems with the jeans. They've got those little rolls hanging over the jeans. So we have special concepts for for these kind of motivations, and others, they just have problems if they wear something topless, and to show the arms, or the double chin. So we also have like treatment concepts for that group. So we really like to know the motivation for the patient. It's not, it's not just that you see this little stubborn fat, Actually, usually there's something behind it, They have something really in mind. They want to go for a beach vacation, or they want to go somewhere, and it's really important to ask for that.
Yeah, so define the areas, the treatment areas which are necessary for the patients, and recognize the needs of the patient. So I think that's very important that one goes to someone like you who has the background and all the understanding for that, and uses the original CoolSculpting, because everything that is really good is tried to be copied by someone. And I think it's very, very big differences whether it's going to work or not. Let's please go back to the advantages in comparison to an operation or a surgical liposuction. What is again like the big plus?
Yeah, I mean, surgery and getting anesthesia is always a risk. You also have some downtime. And this is the great advantage of the CoolSculpting, because we don't have any risk of the general anesthesia. We also have no downtime, and we can really call it nearly like a lunchtime procedure.
Okay, sounds
I think
very
those
promising.
are like the big advantages of CoolSculpting. And we can apply it at different areas.
Yes.
This is also sometimes not so easy with
there's
liposuction.
different areas
If you want to
cannot
have liposuction here and here, but that's easy for us. We really can address the different areas and make it fit for the patient, like a whole impression.
So in total, there's hardly any treatment that is not possible on the body, or any part of the body that cannot be treated. It's very interesting. Thank you very much, Dr. Greiner, for this very interesting conversation. And now we have a patient here, and you're going to show how it's going to be applied in practice, right?
Thank you so much.
Thank you very much.
Welcome, everybody, in our CoolSculpting treatment room. And I brought a really nice patient with me. And she's now going to explain to us what's her problem. So you came to my office, and it was something about your belly was concerning you.
Ich habe halt Problem mit dem hartnäckigen Fett in dem Bauchbereich. Trotz Sport geht das nicht weg. Und ich brauche Ihre Hilfe.
So she was explaining to me that although she really was on a strict diet and she did a routine sport program, she was not able to reduce the fat around her lower abdomen in the belly area. And she was also, she explained to me that it's a little bit cumbersome when she's wearing a jeans. Probably you could explain that a little bit more.
Okay, wenn ich die Hose zumache, dann ist es sehr schwer und das hartnäckige Fett bleibt halt so ein bisschen hängen, so über die Jeans, und man kann auch nicht so enge Blusen tragen. Das sieht nicht gut aus.
Yeah. She recognized that she had some extra fat pads there, but what was more of concern was actually when she was trying to wear a jeans, she had the fat coming a little bit above the jeans, and it was also cumbersome for her when she wanted to wear a really tight shirt. This was really a little bit more showing the little rolls, and that's just what she didn't really like, and that's what she brought her to the office. So let's have a look if it's something we could treat with one of our devices. So you can stand up in front of me, okay? So if we look at her, I mean, she's got a perfect body weight. Her BMI is much less than 30. And you can see that there's some extra fat deposits around the flanks. And what's bothering her is the fat here in the lower part of the abdomen. We can see it if we see it from the side view. Yeah, you can see it's the abdomen used to be flat, and we have this extra fat sitting here. And as we say, if you can squeeze it, we can freeze it. So it's definitely something for our CoolSculpting. for our cryolipolysis. So what we're going to do now to get a really good result, I think we need 2 applicators here in the lower part of the abdomen, one on the right side of the umbilicus, one on the left side. But I would also recommend the patient to treat the flanks. We can do that in a later setting. We don't have to do it at the beginning, but I think it's going to be a nicer overall improvement. So now I've got my CoolSculpting expert, Ms. Bogdanova. She's right next to me, and she's going to explain you how we find out what are the right applicators for the individual patient, because we have to cover at least the whole area. This would to get a really good result. So at the beginning, we have to find out what kind of applicator we need. First, we are marking the highest area of fat. So we need a good cleanse at the belly from different sides, and we put a cross on the area where we have the highest amount of fat pad. So this is now a device where we can measure the curve of the body, and you see that this fits perfectly. Mrs. Bogdanova, she's chosen the Cool Advantage contour applicator because it's one of our biggest applicators and it covers the whole area. And you see that in the middle of the applicator is the highest amount of the fat pads. So this is marking the extent. So now we are changing to a different application platform. And that now is the real applicator. That's the size of the applicator. And she is marking the extent. And now this is the area which is going to be sucked in by the CoolSculpting machine. The cross has to be in the center of the applicator, and now she's marking. And as you recognize, we've got an area where we are treating, where we have like a double treatment. That's in the inner part. And we are allowed to have an overlap of about 20 to 30%, which is perfect here. Which you also have to reconsider is that you should not treat the belly button, because this has a direct contact to your inner abdomen. So we need 1 finger width between that. Otherwise, it's getting a little bit dangerous. Yeah, so this is our marking. And now we're going to go on with the treatment itself. So now we're starting with the treatment. First of all, we are disinfecting the whole area with a soft swab. We had already done the marking. There are several treatment options we have to address excessive fat pads. One is the cryolipolysis, what we are showing you today. With the method of the cryolipolysis, we want to treat the fat cells. We like to combine the treatment with radiofrequency. This is a treatment we recommend to do after about 1 week and then on a weekly basis. The radiofrequency device has the advantage that it's strengthening the skin. Now we have the second step, which is the application of a gel pad. You can see the gel here. The gel pad has a lot of Vaseline on it, and we really have to apply it to the skin in a very, very tight manner because now afterwards we have to attach the applicator, and the applicator sucks in the skin. So we don't want to have any kind of injury of the skin. That's why this has to be in a very smooth and flat manner. There should be no air, no blister between that. The advantage of the original CoolSculpting device is that it has an integrated warning system which would warn if there is something imperfect or if the sucking process is not correctly done, if the vacuum process is not correctly done. So now we've prepared everything, and now we can apply our Cool Advantage applicator. If you look in the interior part of the applicator, you see the curved interior, and you see the curve where the vacuum is sucking in the skin, and that's the area which is going to be cooled down to 4 degrees Celsius. So now it's going to be very carefully applied on the skin, and we still can see our marks which we have put on the skin priorly. Now, with a slight pressure, we press it on the treated area, and now we turn it on. Okay. Now we see the vacuum. The patient is experiencing that the skin is being sucked in. That's what she's telling us at the moment. She says it's not painful at all. She thinks it feels okay. And she likes the gel pad because the gel pad is giving her like a safety feeling. Now, the CoolSculpting expert is checking everything. We give her a cushion now to stabilize the applicator, because it has to be in this position now for the next 35 minutes. So the pillow is used to adapt the applicator, and so that the applicator is fixed on that area. So this is now the beginning of the cooling cycle. The patient doesn't experience much at the moment, but now she's telling that that's like a tingling sensation, but it's like little small needles, but not a lot to feel. She actually admits that it's that's more like a comfort feeling and not uncomfortable at all. And it's very unusual. So now the patient stays in the room for the rest of the 35 minutes, and the temperature is kept at the same temperature. After a while, the patient doesn't really feel something, so she just feels the numbness. And with feeling the numbness, she can really enjoy herself. She can listen to music, she can read, she can do her emails. It's really up to her. She just can relax now, because for the next 35 minutes, she won't, there won't be a big difference, and she won't sense anything different. We give her this kind of emergency button, because the CoolSculpting expert is now going to leave the room, and she's going to come back after 30 minutes. Then she's going to check on the patient again. And after that time, when we remove the applicator, we see the red skin, and the red skin, it looks like a little butter piece. It's really cooled down, and this has to be massaged. And this can release a little bit of discomfort, because it could induce like a prickling, stinging sensation, but this will only be for 2 minutes. And it's very important to massage the skin to massage the skin at that moment, because studies have shown that we have a 68% higher response to the treatment if we massage that area. after the treatment, it could be that the patient has a sensation in that area, more like a paresthesia, that she can't feel anything in the treated area. This feeling will gonna last for, let's say, 4 to 6 weeks. But otherwise, the only recommendation for the next day is to drink a lot of water, like 2 liters per day, and she can do everything she likes. She can do sport. I would be a little bit careful for today, but tomorrow she can do everything.